So today I'm going to talk a little bit about the abdominal fascia, or what we call visceral fascia, that we have in the abdomen. So the connective tissue and fascia is basically surrounds all of the muscle, surrounds our bone, but is also kind of like packing peanuts. It's our space filler that we have in the body. If we had a 3D image of a human being in fascia, you would be able to understand exactly how much we have. So if we took out everything except for the fascia, that's what we would have, would be a 3D image of a human body, and it's everywhere, including our abdomen. And a lot of people don't realize that in between all of the organs and surrounding all of the organs and underneath the skin and underneath that diaphragm is a huge complex web of matrix of connective tissue that holds all our organs together, and it's kind of like a shock absorber, and it creates our stability in our core. So very, very important to keep that functional and to keep that moving. And a lot of times the fascia can become very, very restricted in the abdomen for multiple reasons. One is that a lot of people do not breathe correctly the way that our bodies were designed to breathe. So we were designed to use our diaphragm, which is up and underneath that rib cage, to take a deep breath in and lower that diaphragm, and then take a deep breath out. Most people, especially when under stress, are going to be breathing with their neck muscles to bring that rib cage up to expand lung capacity, not to bring the diaphragm down to expand lung capacity from the bottom. So that is one reason. So our diaphragms and all of our connective tissue around that diaphragm and the bottom of the rib cage becomes stuck and adhered. Another reason is that we, as a human race, we are actually more sedentary now than what we were meant to be. And so with sitting in a contracted position, a little difficult to see here, but in my contracted position, what am I doing? I am contracting all of that fascia. And fascia has about 2,000 pounds per square inch as far as pressure. So that's a ton of pressure and a ton of just constriction around all of those organs. So then what happens with that? If we're not doing stretching, if we're not doing our deep breathing to open and expand, all of that fascia gets stuck and it gets adhered, and then over time, that can cause things like abdominal pain. It can cause things like reflux. If too much pressure is around the stomach, it can cause some acid reflux. It could cause let's see here, digestive issues. So if that's constricting around the colon, you might have problems eliminating. You might also have some GI distress. Can also, if it binds around the uterus and around the ovaries, you could have some challenges with ovulation or heavy periods, or painful periods, I should say, not heavy periods. So there are a lot of different things. And then when we talk about the muscular portion of it, lower back pain. So if that fascia is adhered to the lumbar spine, then the lumbar spine can't move correctly. Well, that affects all of our erector spinae muscles. That also affects our psoas, which attaches to the front side of the lumbar spine and weaves through the pelvis and attaches on the inside of the femur. That brings our knee up. So that brings our knee up into flexion. That's our primary hip flexor. So if the big thing to think about is that with everything that we do, with breathing, with movement, with eliminating our everything that we eat in our digestive system, all of those things can be impacted by having fascia that is too tight in that abdomen. So what do we do about it? We actually have a service called Visceral Massage, and Richard, who is our myofascial practitioner here, he specializes and is quite gifted at myofascial work. He is doing visceral massage sessions, and he's advanced trained in that, and he actually loves it so much that he is going to go on and get his advanced certification, which is about a 2-year process to really learn and dig into all of that information information and implement it. But we're really excited for that. But he has done wonders for people with any sort of a breathing issue, whether that is someone who has a lot of stress and holds their stress here, or performance athletes, if they're wanting to expand their lung capacity to help their cardio and help their performance. And he also has been able to help people that have digestive problems, scar tissue from abdominal surgeries. There are a lot of different ways in which the visceral massage can help you. So if that describes any of you, he is definitely one to look at for expertise in this area. The visceral sessions are 45 minutes. So, and it's very, very concentrated on working that visceral area, also in between the ribs to make sure that your ribs can expand and contract correctly. And it's a pretty enjoyable experience, which sounds kind of funny considering you're working your abdomen, but he makes it a very relaxing, enjoyable session. So if you have any questions, just let us know. Have a great day.